Hey, it's Matt Sloan with Hip and Knee Relief. I wanted to go over 5 questions your surgeon will probably ask you the first time we meet you in the office. The first one is, can you point with one finger to where you're having pain? This is really helpful for us, even though we have x-rays or CAT scans or MRIs. Knowing exactly where you're feeling the pain helps direct us when we get to the physical exam for trying to figure out what the cause of that pain is. Because sometimes people have things on x-ray that might not actually be the cause of their pain. Next, we want to know how long has your pain been going on. So if you have had a fall and you have pain in your knee since you twisted it a couple days ago, that's a lot different than someone who has been having progressive pain in their hip for the past several months or years, and it's just been getting worse. So if it's a recent injury, that's likely to resolve on its own, much more likely than something that's been going on for a long time and getting slowly worse. I really want to know how long you can walk for. When a patient comes in and they say, I can run 5 miles, but towards the end my kneecap starts to bother me, that's a really different patient conversation than when someone comes in, they say they've been using a walker for the past year, or occasionally use a wheelchair, and can only walk for about 5 minutes before they have to sit down because of extreme pain. So the period of time you're able to walk for gives us a lot of information about the functional capacity of the patient. This is a question that we will almost always ask to get a gauge of how you do outside of the office, because on a good day you might be doing differently than the day that we see you. We want to know what you've tried before for treatment. So most folks have tried over-the-counter medications like Advil, Aleve, Tylenol. Maybe a primary care physician has prescribed you a longer-acting medication like Voltaren or Mobic. We want to know if you've had injections before. We want to know if you've tried physical therapy. Have you tried an assistive device like a cane or a crutch? Have you worn a brace? These are all different treatment options that patients could have tried, and if you haven't tried any of these yet, they're a good place to start, because we always want to start with the least invasive treatment first, and then escalate to more invasive treatment options such as surgery, which would be the most invasive of all the treatment options, but only if you need it. So if your pain is well controlled by taking Advil or an anti-inflammatory medication, you can continue to take that as needed, and you'll never need to progress to surgery as long as you're able to do the things that you want to do and have the quality of life that you want to have. Finally, we want to know how healthy you are. So if you have diabetes, how well controlled is it? If you're a smoker, are you able to stop smoking? If you're overweight, are you able to lose weight? Because we know that losing weight not only decreases your risk during surgery of having a complication, it can also take weight off the joints such as the hip and knee that can decrease the amount of pain you experience.